Ladies and gentlemen, welcome to the Hero Health Higher Employment Summit. Please rise for the presentation of colors and remain standing for our national anthem.
All right, I'm going for some close-ups.
Why don't we get started? I'm sure there'll be people coming in and out throughout the morning, given I believe Congress is in session this morning and we had some of the congressional delegations, so we'll see how that goes. First off, what a great venue, and very much appreciate everyone coming and supporting all of us in this great cause. It's a real pleasure for me to welcome you all to the Hero Health Higher program. My name is Rene Lerer. I'm the CEO and Chairman of Magellan Health, and it's a great honor for us to chair this event and to sponsor this and to have some of the distinguished guests that we have, which we'll describe in a minute. Hero Health Higher is a commitment by the healthcare industry to provide employment opportunities for our nation's disabled and wounded veterans. With tonight's speech by the President announcing troop withdrawals, we're here at a great time. I'd like to thank each of you for making the time and making the effort to participate in this initiative and for pledging your support. With us today are representatives from 25 different healthcare companies, associations, and other entities representing a diverse spectrum from across the healthcare industry from all over the country, collectively employing in excess of 300,000 employees and serving tens of millions of members, customers, and patients. We're also very pleased to have senior government officials and military leaders joining us, and those who will be joining us during the program. It's a special honor to have Secretary Hilda Solis, the United States Secretary of Labor, and a personal honor for me to have Governor Daniel Malloy of my home state of Connecticut with me here, as well as some other representatives who are not here yet, but hopefully will be: John Larson, Aaron DeCrenshaw, Ted Deutsch, Chris Murphy, and I know Nikki Tsongas was just here and had to leave and go back to the Congress. There are also a number of federal officials who play important roles in assisting veterans, including Assistant Secretaries Ray Jefferson and Jane Oates from the Department of Labor, Deputy Assistant Secretary John Campbell from the Department of Defense, Administrator Pam Hyde, and a Special Assistant to the Administrator Dr. Joriel Brown of the Substance Abuse and Mental Health Service Administration at the Department of HHS, and Deputy Assistant Mark Johnston from the Department of Housing and Urban Development. I also want to especially acknowledge the distinguished members of the military here, including Rear Admiral Moira Flanders, Director of the Inter-American Defense College, and Lieutenant Colonel Dennis Hart, U.S. Marine Corps, Action Officer for Warrior and Family Support on the Joint Staff, and other representatives from various branches of the military. Admiral Mike Mellon, the chairman of the Joint Chiefs, has been eloquent in articulating the issues faced by returning veterans in this challenging economy. The business and the community leaders in particular have been challenged by Admiral Mellon to find ways of offering great support and assistance. He talks about extraordinary sacrifices that these heroes make without question, the physical and emotional toll on both those who serve and their families, and of the difficulties faced as veterans make the transition from warrior to civilian. We know that unemployment is an issue with returning veterans. Today, we are launching an effort by the healthcare industry to give back to those who bravely and selflessly served our nation by helping them successfully transition into the workforce, supported by the necessary professional tools, training, and counseling to help them retain those jobs. In accepting the invitation to join Hero Health Hire, every company represented here today, and the several who have expressed support but were unable to attend, has committed to hiring wounded warriors. Some have well-established programs in place, and others are building those programs and want to benefit from the best practices of others. Everyone will have an opportunity to take advantage of the collective wisdom in the room and create better coordination so that we're pulling in a common direction to help veterans find jobs. It is important to stress that this is not a one-and-done event. Today is only the beginning of a concerted effort that will hopefully serve as the catalyst to link wounded warriors with employment opportunities in the healthcare industry. Our ongoing goal is to expand the participation in the program more broadly, and I'm hoping that each of you will engage business colleagues at other healthcare companies to join us in this effort. On behalf of Magellan, I want to say how proud we are to be hosting this event. It's really an extension of our culture of caring, where we identify ways to give back to the communities where our customers and our employees live and work. It is something that we're passionate about and is a source of pride to our employees. The issues facing veterans are of particular interest to us because of our deep experience in working with those who have behavioral health issues. Part of Magellan's commitment to veterans and to those of you who are joining us in this effort is to provide employee assistance programs designed specifically for wounded warriors transitioning into the workplace. We will offer this program to any wounded warrior recruited through this effort at Hero Health Hire in any participating company. Our format today is straightforward. We're going to hear from several people about the opportunities in hiring wounded warriors. Our government officials will have a unique perspective, and we will be turning to several of them, starting with Secretary Solis. Following that, we will have roundtable discussions on 3 topics: how to successfully recruit and retain veterans as employees, the challenges faced by veterans entering the workforce, and what we need to consider as employers, and what support is available for veterans and for employers who want to hire veterans. We have discussion leaders for each topic, and they will speak briefly and then open the dialogue to those who would like to speak. I will remind you that we've allotted about 20 minutes for each topic, so please keep your comments brief, so many of you can participate. Thank you again for attending today's summit and joining in this effort by the healthcare industry on behalf of our nation's heroes. Now I'd like to recognize Secretary Hilda Solis, the United States Secretary of Labor. Secretary Solis has been very kind to spend part of her day with us on this important matter. She has been vocal on the issues of veteran employment, and the Department has a very robust effort aimed at developing career and educational opportunities for veterans and their spouses. We are honored that the Secretary was able to make time to join us for the launch of Hero Health Hire. Secretary?
Thank you so much, Dr. Lerer, and to Magellan's commitment also to be able to host this event here, this summit, the first of its kind, I believe, and you're to be commended for doing that. And I hope that we can continue this journey that we're on and hopefully reach as far and wide, East Coast to the West Coast, where I'm from, and that we can engage other corporations and business community as well as our elected leaders that can help us in this endeavor. I want to say thank you to Governor Malloy, who's visiting here from Connecticut. Thank you. It's great to be able to work with you in partnership on so many issues on workforce training, but in particular on this subject. And Assistant Secretary Campbell, also from DOD, it's been a pleasure working with you. And also to the congressional members who I understand may not be here yet, but as a former member of the House, I know how deeply concerned each and every one of them is regarding this issue, and I think that is something that I share with them. The fact that it is important for us to stand up for our military veterans and for their families, and I salute you, those that are here in the room, our veterans that are currently serving us, as well as your families, because without that, I know we wouldn't be able to do the many good things that we do. And I want to say a very special thank you to the healthcare companies that are all represented here today. This is a tremendous effort. I can't tell you what a delight it is to see you here at the table and to know that this is just the beginning of a partnership that I hope you will help us enlist others to join with us to continue this chain link that I want to call. It's a link because it's a strong bond that we have, a commitment to help provide support in one of the most honorable manners by serving our veterans as well. Because they have given so much to us. I think it is appropriate for companies to understand that it is their and your patriotic duty to help your bottom line companies by making them more productive, by enlisting and attracting some of the most dedicated young men and women who serve in the military forces. Each time one of your companies hires just one wounded warrior, you help to break down that stigma. I can't tell you how important it is to see the faces of many of these young men and women who I've had the opportunity to see across this country, visiting them, whether it's at military hospitals or recently at some of our job corps centers and some of our one-stop centers, where many of them are looking directly into my eyes, asking, where am I going to go now? What future do I have? What opportunities are available? And what I can tell them now, in many cases, is that, again, there are people like you that are stepping up to the plate that are going to make a reality for them, that they will have a safe place to land when they are, in many cases, complete with their physical therapeutic training that they need or assistance. Many of them are coming back, as you know, very challenged with many different obstacles and challenges ahead of them. But when I go out and I visit with some of these military veterans, I'll tell you one little story. I went out to Texas at a hospital there and visited 6 wounded warriors that were in a round table to talk to me. One of them was one of the last speakers. He was about maybe 25 years of age. He was very quiet. At the end, I asked him, well, what do you see yourself doing? He says, well, I would love to be able to teach. And I said, really, you want to be a teacher? He said, well, my wife's a teacher, and we both decided that's something that I want to do, and she's going to help me and assist me in that. And this young gentleman had just returned from war and had lost both his legs. Find out afterwards, as I'm walking in the facility, that he is one of our star triathlon athletes there. And he didn't say a word to me about that. So to me, there is just so much value and investment that we can put forward in these kinds of individuals that will be disciplined, that will be hardworking, and that will make quick recovery once they know they have a place to land. And many of them, as you know, I don't have to tell you, are already professionally trained in some areas of healthcare, but need a lift up. And I think that that's something that all of you here can help provide, that I don't want to say safety net, but another safe landing for them. And I think that's probably something that we all can believe in and want to see happen. I am very excited and to see all of you here, the mental health services providers, because you play a very essential role here. Insurance companies, pharmaceuticals, device makers. You are the appropriate people to be at the table to help us begin this discussion, to make sure that we make the right decisions, that we open up those doors of opportunity for these particular individuals that are in need of this help.